Hello, welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Glad that you could join us. Our guest is Mr. David Griffiths, a representative from Nurses Service Organization. David is here to talk with us today about the launch of a new professional liability insurance program. Welcome to the program, David Griffiths.
Thank you. Glad to be here.
We've spoken with your organization before. Talk about how you function there at NSO and what is it that you do there?
Certainly. So I am responsible for the NSO program, so Nurses Service Organization. Started over 40 years ago offering insurance, professional liability or malpractice insurance to nursing professionals. And then sometime later in about 25 years ago or so, we expanded coverage and opened it up to a burgeoning class. It was nurse practitioners, and the desire that and need that nurse practitioners had in their expanded nursing role to have coverage. This is really the offering that we're now opening up for CRNAs is really the next expansion. And if you sort of think about the nursing profession, you have your RN, and then you have what's called an advanced practice nurse, or APN, or APRN. And there's really four classes of APRN. Nurse practitioners being one of them, as I just mentioned. Clinical nurse specialist is another, which we also offer coverage for. Then there's the CRNA, and that is the newest class that we were offering. And then the final one, just to round this out, would be midwives, and we're working on something for that now.
Does participation require a membership in the NSO?
No, it really doesn't. So the coverage is really, and it's funny because a lot of our customers refer to themselves as members. So if we're presenting at a conference or exhibiting, oftentimes we'll have somebody come up and say, "Oh, I'm a member," but you really don't have to be. There is. For the CRNA, there really is a large national association, and if you wanted to obtain malpractice coverage for yourself or for your practice, and you wanted an admitted carrier, which is the preferred carrier, you had to belong to the National Association. With our coverage, with NSO and our carrier CNA, you don't need to be a member. So we've sort of opened up the box, so to speak.
I assume that there's a great deal of liability, especially when you're dealing with nurse practitioners. Is this coverage tailored toward each individual, their area of expertise, or whether or not they belong to certain associations?
That's a great question. Really, if we talk about the nurse practitioners, their role, as you had alluded to, has really expanded, and it's something that they have pushed for, the nurse practitioners themselves, and now there's over 25 states that allow a nurse practitioner to practice at their education level, and so they're working independently in many states. And while we have seen malpractice coverage in those states, the need for it expand, because as you would imagine, if they're now opening up their own practice as opposed to working at let's say a family practice, they now need their own coverage solely by themselves, and may not have the ability to rely upon an employer's coverage. So certainly the need for that has grown. If you sort of take that same thinking over to the nurse anesthetist world, many similarities. You have nurse anesthetists who may work in a hospital, may work at a specialty miscellaneous facility, or on their own, opening up practices. So there are a lot of similarities between the nurse practitioner as well as the nurse anesthetist. That being said, again, there are certain things like the nurse anesthetist is one of the differences in their policy is around consent to settle. And so when we were developing our product with our carrier CNA, by the way, CNA has over 15 years of experience covering nurse anesthetists. They've been they were with part of the National Association and have just repartnered with us. So great news there. But the consent to settle was something that they were very confident in, that the nurse anesthetist wants to have that. So it is a part of our practice, our policy practice. And in addition to that, things like moonlighting and part-time, which are activities that a nurse anesthetist may do more often than a nurse practitioner, we've also folded those discounts into our policy as well. So those are just two of the highlights from a difference.
Can this coverage go with a professional as they advance in their advanced training? Say, if you're on the path to becoming a CRNA, but you're not there yet, can this coverage morph with your career?
Absolutely, and it is kind of funny because we will run across the nursing professional, nurse practitioner, or CRNA who would say, you know what, I had your coverage when I was in school. So we do offer coverage for students, whether you're doing your undergraduate for your nursing degree or you're in school as a SRNA, student, registered nurse anesthetist, and we have coverages for you there. Once you graduate, we have professional policies. As a matter of fact, even if you're a student, we offer coverage to the school. So that's a coverage that we do offer. So if you're an educator and you're looking to have coverage for your students, let's say while they're doing clinicals, we have a policy that will cover all the students plus the faculty. So it's something that we offer at a macro basis. And then if you're a professional, you want to branch out on your own, our coverage policy is the same and for the whether you're employed or self-employed. And then if you're looking to start up your own practice, then we move you into what we'll call a business practice. And we have over 25,000 healthcare businesses that we cover as well. Obviously not all CRNAs, but that's sort of the kind of the what I'll call it the student to firms line of coverages that we offer.
Now, where can our listeners go online and learn more about NSO and more about this brand new liability insurance for CRNAs?
Yeah, absolutely. So our website, NSO.com, does have a page specific to CRNAs and provides coverage details as well as a way, if there is interest, to get a quote. And in addition, because we're new to offering coverage to CRNAs, we've started to develop case studies. So again, the great news about having CNA as our partner is that they have been covering CRNAs for, as mentioned, over 15 years. They have cases, and one of our risk education activities that we work on is really around developing knowledge in the case of CRNAs, and case studies is a tool that we leverage for that. So one of the things that we will often go out and do is to present at conferences or present at schools. And we see that a lot of CRNAs, professionals really enjoy hearing the case studies and learning what others did and how then they can reduce their risk exposure. So it's a tool that we leverage as part of our package to to CRNAs.
Sounds like win-wins all across the board. I thank you for coming in today, David. It's been a pleasure. Representative from the Nurses Services Organization talking about a newly launched program for CRNAs. Thank you for talking with us today, David.
Thank you. It was a pleasure to be here.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm.